Now this is the case study of 27 years old married female Paris with history of 2 cesarean sections, now has irregular menstrual periods for which he has been referred. What we can see in this, we see in this view is this is the uterus, and we see this is the endometrial canal, which is in the early proliferative phase. This is the urinary bladder. Below the uterus you can see this is the fluid with bowels floating within it. Now this is the longitudinal section, as this is the fundus. This is the fundus, and here you can see small amount of fluid also seen around. Now this fluid is tracking into the right adnexa and then extending into the right lower abdominal quadrant. This is the transverse section of the uterus, and we can again see fluid with bowels. Transverse section of the uterus, endometrial canal, fluid, bowels. Now these are iliac vessels. Left iliac vessels, and when I move the probe to see the right adnexa, there is seen solid echogenic mass with internal punctate calcifications, tiny cystic areas within in the region of the left adnexa. Here it is. This is the well demarcated solid echogenic, highly echogenic mass measuring approximately 40 by 40 mm. You see cystic area within, well demarcated. Posterior wall is seen, no back wall enhancement, and there are punctate tiny calcifications also seen within it. Now this is a magnified view that I am showing you. I am going to give a sweep to the probe now to see whether it changes its shape or retains its shape. Here you see it did not change its shape. If you concentrate on this area, I am again going to give a sweep. I want to tell you one thing. See, there are multiple marginal calcifications seen, and there are internal calcifications also, along with tiny sub-centimeter cystic areas. Okay, now let's give it a sweep and see whether it changes its shape or it doesn't change its shape. It does not change its shape. It remains as such globular. And is there any blood flow within it? There is no blood flow seen. These are the so this is the case. This is the study of one solid mass that we are seeing in the region of the left adnexa. Let's move on to the study. Now there is fluid. I want to show you the fluid also. Now this is in fact lobulated sort of mass, as the other part of this mass is here. This is the other part of the mass. This is the main region. Here you see now, this is the mass. With fluid around. Now you see this is fluid. This is small amount of fluid. Left adnexa we are seeing. This is the solid, well demarcated echogenic area with internal calcifications, marginal calcifications, sub-centimeter tiny internal cystic areas with no blood flow seen within it. Now let's move on to the right adnexa. Here transverse section of the uterus. Now you see there is also a solid mass of same configuration that we saw on the left side, which means well demarcated. This is well demarcated. Internal tiny cystic areas, marginal calcifications, internal calcifications, no backbone enhancement, posterior wall clearly defined, and no significant blood flow is seen. You see the bowel movements within the aside fluid that is surrounding this solid area, this solid mass, echogenic mass. Now, as I move the probe bit upwards, there is another mass which is consistent. Now you see this mass is in continuity with the solid one. This is the one which is solid, this one, and it communicates with another cystic mass. Now this is a cystic mass with internal linear, multiple uncountable linear structures, which is possibly bunch of hairs within it, tiny calcifications, cystic area. This is the cystic area, posterior wall, outer wall of this measures approximately 6.4 into 6.2 centimeters, and now this is consistent, this area up to this area. Now this area in the region of the right adnexa is consistent with the dermoid, whereas this area is consistent with the teratoma. So this is solid and this is cystic with internal calcifications, linear area, debris. So this is a dermoid, this is a teratoma in one patient. We are seeing in the region of the right adnexa, both in the region of the right adnexa, and they are surrounded by fluid. Now I'm going to give a sweep to the probe to show you whether this cystic area changes its shape or it retains its shape. So wait, here it is. This is the cystic area under study. Going to give a sweep to the probe, and here you see it does not change its shape. It retains its shape, and so this is our case. Now uterus. I have shown you fluid in the pelvic cavity as well as fluid in the dependent region peritoneal cavity. The rest of the ultrasound that I've seen is unremarkable. Now this is fluid again in the dependent region peritoneal cavity. Bowels are seen floating within. So little review. Solid mass with internal calcification in the region of the left adnexa, communicating with a cystic mass there. Right adnexa, now towards the left adnexa, the uterus, and here you see is the solid mass. Both ovaries are not visualized, and this mass is in fact extending from here to here, measures 7.2 into 7.2 into 2.8 centimeters. Okay, and is surrounded by fluid. This is measures 6.9 into 2.8 centimeter. This is the region of the left adnexa, and this is the solid mass. So this is our case of the day. Thank you very much.